Hi everyone, this is Mark Nisly. I'm presenting on my service learning project with Lancaster, Lebanon, Habitat for Humanity. My service learning project was completed at Lancaster, Lebanon, Habitat for Humanity. This is the local chapter of the international wing of Habitat for Humanity International. The population served by Habitat for Humanity is primarily housing insecure families located in the cities of Lancaster and Lebanon. Many of these are refugees displaced by genocide such as occurring in Syria right now. Some of the traditionally homeless are also served by Habitat for Humanity, but this is not as common as the housing insecure families. Several services are provided by Habitat for Humanity. The primary one, of course, is providing affordable housing for families who have trouble affording a mortgage or even the rent for a decent apartment. This is accomplished by utilizing volunteer hours, reusing as much hardware as possible, and in particular, utilizing the sweat equity of the recipients. This brings me to the reasons I selected Habitat for Humanity for my service learning project. I currently provide healthcare for housing insecure in a hospital setting, but I don't really understand the needs of this population out in the community. Lancaster, Lebanon Habitat for Humanity, Lancaster, Lebanon Habitat for Humanity addresses this population's community needs within the same city as my employer. A second reason for selecting Habitat for Humanity is that their model for involving recipients very much appeal to me. The efficacy of this model is borne out by the fact that 97% of Habitat for Humanity housing recipients are able to keep their mortgage. Another service Habitat for Humanity supports is restoring rundown houses in sections of the city. This revitalization of poor parts of the city also appeals to me. In the next several slides, I will briefly address the needs of the housing insecure. First of all, how common is homelessness? On a single night in January 2017, about 500,000 persons were homeless in the United States. Approximately 35% of these were unsheltered. The housing insecure face a variety of distressing challenges. For this discussion of the needs of the housing insecure, I will primarily be discussing the homeless as there is the most specific evidence in the literature for this population. Poor physical health is exceptionally well documented in the literature. The homeless tend to be overutilizers of emergency rooms and have high rates of readmissions to hospitals. Davies and Wood suggest that this may be because they tend to wait to address health needs until they're too large to ignore any longer. Logistics are difficult for the homeless. Most do not have adequate healthcare coverage to see a primary care provider or to get medications. They rely on public transportation to get their appointments. Or their medications are susceptible to being stolen or confiscated due to transient housing. Additionally, violence and substance abuse occur more frequently among the homeless. Not only does this increase morbidity and mortality, but also is a significant risk factor for prolonging homelessness. Poor mental health is another frequent and significant challenge for the homeless. Poor mental health has been shown to cause and perpetuate homelessness. In a study by Tu et al., about 50% of homeless in a Canadian uh, homeless shelter had a mental health diagnosis. Trauma has been experienced by almost every homeless person. These are all significant needs of the population. A few other problems associated with homelessness are social isolation, poverty, high incarceration rates, and lack of safe, affordable housing. In this section, I will briefly describe how healthcare professionals, especially nurses, can address social, political, economic, and cultural needs of the housing insecure. This will be discussed primarily in the context of my service learning project. These areas are difficult for healthcare professionals to effectively address in the acute care setting. This requires civil activism and altruism on the part of concerned healthcare professionals who truly want to make a difference in the lives of a vulnerable population. My service learning project centered on social and economic advocacy. The biggest thing professionals can do is get involved in the community with organizations who are helping the homeless. In my case, volunteering for Habitat for Humanity directly addresses a social need for better living conditions for the housing insecure families. In the acute care setting, it's difficult to effectively intervene socially. The nurse does have a small window to be able to try to educate patients on better healthcare behaviors and to connect these patients with community organizations who can continue to assist them. Showing compassion is one of the most important things a nurse can do when caring for this difficult population. Too often I have fallen in the trap of judging a patient for frequent preventable acute care admissions instead of offering compassion, or at least a curiosity about what this person must be facing. The healthcare professional needs to communicate with political representatives in order to effectively advocate for political issues for the homeless. One of the easiest ways to do this is to write to your political leader. Something else that nurses can do is to be an advocate for the homeless in everyday conversations with coworkers and friends. Due to the nature of being homeless, economic instability is one of the most pressing needs they face. As previously mentioned, the nurse should model civic responsibility and altruism to help the homeless. This can be through volunteering for or donating to organizations who assist the homeless. The nurse can also be sure to maximize economic resources when the patient is in an acute care setting. A nurse may be able to help a patient receive the first month of a medication free with a manufacturer rebate, or perhaps coordinate free transportation home from the hospital. Cultural advocacy is difficult in the acute care setting. One of the most obvious ways to advocate culturally for a patient is to provide qualified interpreters when having any crucial conversation with the patient or family who do not have English as a first language. Several ways to advocate culturally in the community are to teach English classes to refugees or be a family coach for an immigrant family. I personally have friends who have done both of these for immigrants. In this section, I will discuss how I accomplished my service learning project. Last year, during the introduction to the capstone course, I selected Lancaster Lemon Habitat for Humanity based on the course criteria and my personal interest. Following a preliminary approval by my advisor, I completed a Getting Plugged In orientation course and safety training videos required by Habitat for Humanity. At this point, I wrote objectives for the service learning project. These were reviewed and edited with my advisor. Following this, I was approved by my advisor to continue my service learning project. After orientation and advisor approval, I began volunteering for Habitat for Humanity. My volunteer hours mostly consisted of construction-related tasks such as installing handrails, laying flooring, and construction cleanup. The required 30 hours was completed by this fall. I believe the service learning project was an effective teaching method to apply the principles of the BSN program to a vulnerable population. If I had it to do over, I would have tried harder to get into another organization that gave me more exposure to the actual target population. In my 30 hours, I had no contact at all with any of the recipients. After my volunteer hours, and especially my review of the literature regarding the homeless, I'm convinced that we are not doing enough to help the housing insecure. There are still way too many families and singles who do not have adequate provisions for basic necessities. In this last section, I will address the outcome of my service learning objectives and the impact of the project. I was able to meet all of my formal service learning objectives, although not all in the way I expected. For 1 and 2, I was able to identify the vulnerabilities and healthcare challenges of the housing secure, but this was primarily achieved through literature review, not through exposure from volunteering with Habitat for Humanity, as I had originally envisioned. Objective 3, I was able to identify 2 organizations through my volunteering. And objective 4, I did participate in parts of 3 building projects, so this was met as well. Through my volunteering hours, 2 families were able to find stable, decent housing. I do plan to attend the home dedication of one of these homes in 2 weeks. Here's a picture of one of the homes I helped to repair. I was deeply impacted personally by the service learning project. I came away feeling a new respect for the impact nonprofits make on our community. I was also impressed with the difficulty it takes to run a nonprofit well, maybe especially the areas of needing to secure funding, resources, and volunteers. I also really appreciate the push that this project gave me to start becoming involved in my community. I have a much better understanding of the challenges of the homeless as well. In my personal assessment of the service learning project, I believe it overall to have been an effective educational instrument. This project facilitated exposure to out-of-hospital organizations who are assisting with the target populations. However, I did have no contact with the target population. I believe this somewhat limited the effectiveness of the project, but perhaps other students had a different experience. The review of the evidence and the process of writing Chapter 2 for my capstone paper was very significant in my professional development. Both the service learning project and the review of evidence are key pieces in the entire capstone project. I believe that the process of writing the entire document was very formative for me. In particular, the capstone paper demonstrated the skills and knowledge I learned in the entire RN to BSN program. And finally, here are my references. Thank you.